Hello and welcome everyone to the Solve ME webinar series. Today we're hosting a really unique and special webinar with some special guests. So thank you all again for joining us in the morning for those of our friends on the West Coast and this early afternoon for our friends on the East Coast. My name is Emily Taylor. I'm the Director of Advocacy and Community Relations for Solve ME CFS Initiative, a nonprofit organization dedicated to solving the disease myalgic encephalomyelitis, chronic fatigue syndrome, and so pleased to bring you this very special webinar today. Today we're talking about COVID long haulers and the ME/CFS community joining forces for progress. So thank you once again for joining us, and without further ado, it is my pleasure to introduce the Solve ME CEO and President, Oved Amitay.
Thank you, Emily, and thank you everyone for joining us on this webinar. Before we get started, I'd like to pause and recognize the more than 100,000 people all over the country who are in hospitals today battling COVID-19. Their families and caregivers, and those who lost a loved one to this devastating disease. Our hearts go out to you. And we're thankful for all those on the front line who are fighting this disease every day. So why did we organize this webinar today? Well, learning from history, we know it's not unusual for people to develop chronic, debilitating symptoms after infection by a wide variety of viruses, bacteria, and other microorganisms. It can follow common infections like mono or Lyme disease, or emerging and more severe diseases caused by Ebola, SARS, and West Nile virus. So we know that a trigger can really lead to those long-term clinical symptoms. And the symptoms of post-COVID long haulers in many ways can be indistinguishable from those typical of those illnesses that we've seen before, including myalgic encephalomyelitis or chronic fatigue syndrome, ME/CFS. Indeed, in many people with ME/CFS, the illness started after an infectious-like illness, or in some cases, a well-documented infection. And the US National Academies of Sciences estimates that as of today, there are probably as many as 2.5 million Americans who are suffering from ME/CFS, and this is before the COVID-19 pandemic. And of course, the pandemic may drive these numbers even higher. However, our understanding of the exact reasons for why some people recover while others go through a long-term symptoms is very limited. And to a large extent, that's because of most of the research is actually conducted many months after the initial onset. And the trigger may not always be known. This, of course, makes it very difficult to develop specific and accurate diagnostic tools and treatments. Now, the current tragic pandemic does give us an opportunity. And I said that obviously it's very difficult to use this term, but from a research perspective, it does give us an opportunity to get to better answers. But I think we believe that in order to do that, we all need to come together, share existing knowledge and experience, and link that with new lessons and insights. So today's webinar is really meant to foster the connection between the ME/CFS community and the COVID-19 long haulers, with the belief that joining forces will ultimately be to the benefit of all of our communities and perhaps other disease communities that could benefit from working together as well. So we would like to do our part, and we start today with the wonderful guest that we have today. So I'd like to introduce Hunter Howard. Hunter contracted COVID-19 early in the pandemic. Hunter is the CEO of Hormone Therapeutics. And shocked by the lack of solutions to the epidemic very early on and still now, Hunter launched the Global Pandemic Coalition to drive the much needed services, and also connected with many other survivors to start the search for answers. We're also delighted to have Karyn Bishof with us. Karyn, thank you for joining us. Karyn was a fighter and a paramedic and he's now unable to work due to the lingering effects of COVID-19. Karyn founded the COVID-19 Long Hauler Advocacy Project, which is focused on advocacy for survivors, long haulers, and for their care. And of course, we'd love to hear more from both of you during the webinar today. So perhaps we can get started. Hunter, maybe the first question for you. If you could tell us really about your experience with COVID-19, how did it start?
Yeah, I think a similar story to a lot of people that are probably on this call, where I contracted COVID-19 just over 9 months ago. I was in Colorado, and it was very, very early when it came to America, and I had a particularly bad case, about 5 or 6 really bad days. But I felt so much better after that I thought I'd improved. The 21 days, 10 days later, I was convinced that it was past me. But 24 days later, I actually was tested again. I still had it in my system. So that was just confusing to me, and it was confusing to the doctors. Because of my healthcare background, I'm friends with a lot of the doctors. I've worked with the top pathologists in Dallas, and they were just really confused over why I might still be testing positively 3 weeks later, particularly 14 days after any symptoms. The most important thing for this call is that it took me months to feel. In fact, today I still don't even feel the same way I did. So it's been 9 months. I still have exhaustion. I still have fatigue. 6 months of severe lung capacity issues, headaches, brain fog, I've had GI issues. I've had depression. I've had all these things that have just been lingering. You have a good day, then you have a bad day, and you think you're beyond it, then you got to get hit again. And so it's a lot of the stories that I'm hearing from all the other long haulers that it's a very frustrating situation because of how little we've understood about it the whole time.
And Hunter, when did you reach out to others? When did you feel that you are going through something that perhaps others are going through as well? And what led to your interest in connecting with others at that point?
So having a healthcare background and being an entrepreneur, it's kind of probably a different visibility than a lot of people had it early. So the doctors were very honest with me early about how little they knew, and they were learning from me. We were learning together. So that was surprising, but also terrifying. And so frustration on the medical side, and also a lot of frustration on the response side. And not to be political, but I'm an entrepreneur. I see issues, and I like to resolve issues, and that's kind of been my career. And so I was just really looking at why don't we have a daily update? Early on, this is in March, a daily update with top epidemiologists and a general up there talking about infection rates, beds available, PPE, vents. What are we doing with the DPA to make sure that America has the best, or that we have the best supplies available and control that distribution? So I was just surprised that none of that was happening. And I had some relationships in Washington, both in the military and in the White House. And we started trying to figure out, what do you need help with? And it then became a state issue. So I said, well, this is so surprising to me that how each governor, each mayor, each CEO, each school administrator is now left to come up with their own solution to handling a global pandemic and their own response. And so I was just going, this can't possibly work well, for each of these to have to come up with their responses. So I got to my friends and said, guys, this is not going to work very well. And this is so far over the pay grade of all the individuals. We need to lean in. And I said, if not us, who? And that's kind of where it came down. If not us, who? And I think I was uniquely situated in that I'm part of a couple of international boards of healthcare CEOs around the world with the YPO, startup health community, and said, guys, we need to put together some solutions because we need to help find the best-in-class solution and deliver to the people who are so far over their heads and figuring out how to handle this on their own. That's kind of how we came together, and it's been frustrating, but it's been interesting. We kind of were looking at, okay, how do we get testing to where it's needed? Who has the best tests and how do we get them to where it's needed? Who has the contract tracing? How do we ramp up contract tracing in America the same way it's happening in Germany or in South Korea right now? We have proximity tracing apps, that my friend Chaco in India has this incredible proximity tracing app, same thing that Google and Apple's doing, where you can find out who you've been around that might have had it. And so this being used across India, being used in a couple other countries. It's also being used in a lot of corporate structures where they're working in pods and trying to figure out, okay, who have you been around that might have had it? So anyway, we're trying to come up with the best-in-class solution, PPE, sanitization. Another friend is doing testing at food plants, and we have so we're just coming up with this together to offer these solutions, and that's what we've been focusing on. And
it sounds like very much your experience was influenced by your background. How do you see the IT healthcare background that you bring with you? How do you see it being deployed in this situation?
Yeah, no, we were all just kind of looking around at each other and going, we can lean in here, and we know how the healthcare system works. We know how to deploy resources. We know actually to create technology within a healthcare environment, which is very different from just creating technology in a normal environment. One of the things we created was my friend Suresh Patek probably created the largest PPE marketplace in the world to try to, and just billions and billions of dollars of PPE that's been created. We're excited. In January, we're going to have a COVID marketplace trade show, virtual reality, where you would come in an avatar and you will see some world-class speakers talk about these issues. But instead of being in a conference and a trade show, there'll be vendors, 1,000 vendors, but it's actually all going to be in avatar in a virtual reality environment. So we're just trying to figure out how do we come together and use technology in our healthcare to kind of improve the situation. That's where we've been focusing.
So, from your perspective, Hunter, what do you think is the next step for research? How do we move from just understanding individual stories to really connect all of that into data that could really lead to new solutions?
You just said the most important thing is aggregating data. That's what we start by aggregating data to understand this better, and so that's going to require deep research, broad research, vast research, and it has to be funded at a national level or at a global level. And so, we're only starting to understand. I mean, so much of kind of our healthcare economics in America are tied to kind of the pre-existing conditions that people are going to have right now. So we need to understand so much more about what the COVID survivors are going to be dealing with. And so it's the analysis. It's got to happen from the top down or from organizations like you. But one of the problems we're going to have, though, is so much of this great research comes from pharma companies. And the two interesting issues are that pharma companies are trying to get the ROI on producing a product that could then be sold. And so that's where they're going to make their money, and the ROI on that. And then Americans, we like to be given a pill that fixes things. And we're not as interested in learning about lifestyle modifications or gradual improvements through life. And so that's really one of the hardest things we're all going to have to deal with. But this is going to be a long, slow process. It's going to take a lot of data, a lot of research, and organizations like you guys to help us understand this.
And what do you think will take industry to get interested? What do you think will get the pharma companies to be interested in understanding long haulers, and why haven't they been looking at this up until now?
I think you're probably, I would ask you that question because you're probably closer to seeing that than anybody else, because understand if they're looking to, if they can package it in a pill that they can sell, that's what the board wants to see. But if they can't do that, then we are left in a situation where we are, the pharma companies are not going to invest deeply. And so who then is going to invest in it? It's kind of these nonprofit organizations like yours that are really going to be the ones that are helping us figure this out. And that's why I'm so thankful we met you.
Yeah. And I think it is a lot comes from really understanding the fundamentals and the basics of this disease. And maybe we can put the next slide on the screen, because one of the efforts that we've been engaged in, frankly, well before COVID-19 entered into all of our lives, we're focusing on creating a large data set, which we call the U&Me registry. And the idea was to generate big data, exactly for all the reasons that we've been talking about. And so now we've opened another portal for this registry to begin to collect information and the experience of long haulers that could be even really be tracked on a daily basis. So, Hunter, with your familiarity with the community, what are the ways that we could work together and really be able to collect this kind of information that we need in order to translate that for treatment and better diagnostics.
There's good news and bad. Good news is there's passionate people who are so interested in helping out. I mean, there's so many people who have survived who just, so their lives changed. Their lives, they're different. They're frustrated, they're lonely, bored, they're misunderstood. But then how do we connect them with, groups like this? So, to me, if we can create kind of a global army of people that are passionate about understanding this, they're passionate about bringing their friends in. The social media communities that are out there, there's, about 50 of them that I'm a part of right now. I'm listening to these people tell their story. They're bringing their doctors in to educate their doctors on COVID long haul. And it's like, can I bring my doctor into these communities? And so it's reaching out into these communities, passionate people who just are looking for an understanding. And then you have the connection with these groups is really going to be, I think, the biggest way to quickly get so many people and to get so many people into this program. I mean, you have this amazing registry. The research you're going to do is what's going to help us figure this out. And so I beg everybody, reach out into your communities, reach out to your other friends with COVID long hauler and get them involved, and let's collect more data. The more data we have, the more we'll learn, the faster we'll learn. And we need organizations like yours that are already set up to help us understand that. That's like this registry right here.
Thank you, and of course, we're committed to do that and work with many other organizations out there, and really try to put together the most effective collaborative effort to understand this challenge. It would take all of us in order to make a difference. So, Hannah, I wanted to thank you, and at this point, transition to Emily and Karyn, and learn more from your experience.
Wonderful. Thank you so much for those comments, Oved and Hunter. That was really insightful. And I think there's a lot of reasons to hope for both the ME/CFS community and the COVID long hauler community. And so that brings us to the second part of our presentation today with Karyn Bishof, who is a firefighter and a paramedic, but is currently unable to work because of the lingering effects of COVID-19. Karyn is a single mom who's been diagnosed with ME/CFS, POTS, and fibromyalgia, and she also suffers from an additional autoimmune disorder that is yet to be formally diagnosed. Ms. Bishof, or Karyn, if I may, founded the COVID-19 Long Hauler Advocacy Project, which is focused on advocacy for the survivors of the long haulers who are currently in care. Karyn, thank you so much for joining us today. Truly, I've been so excited to meet you, and we haven't had much of a chance to communicate outside of email before this conversation. So I guess I'll start with what could you share about your experience, or what insights do you have about the pandemic, both from your experience as a frontline first responder and also as a patient who then got COVID-19?
Thank you for having me. So I would start first with talking about my experience as a patient, because I think that that's what people here will relate to most. So I got COVID-19 fairly early on, also in March. At the time I got COVID, we were only hearing about the cases out in Seattle. So we weren't really aware that people here in South Florida had it. And when we got it, we really all thought that we just had allergies or a cold at first. So I was one of the first cases here in South Florida. I was only able to get tested at a first responders only testing site. And one of the biggest issues that we see in long haulers is, unfortunately, anywhere from March, April, May, people struggled to get tested because we knew so little about this. It was dependent on, do you have a fever? Check off these symptoms. And we now know how many symptoms are involved in COVID at this point. So my experience in the beginning, I would say I had a mild to moderate case. There was maybe 2 or 3 days with pre-syncope issues that I probably should have been in a hospital. But being a first responder, I felt like I needed to manage it at home. I didn't want to overwhelm the system. I just felt like I needed to rest, get better so that I can go back to work and do what I need to be doing. As you stated, I have been diagnosed. I'm now basically 9 months post-diagnosis. I've been diagnosed with chronic fatigue syndrome, POTS, fibromyalgia. We're we're looking at all the autoimmune diseases. We just can't pin down what it is, but it's there. And just a ton of other things that I've never had before that are quite serious. If you're in our group, you've probably heard me talk about many of them. I'm very open and vulnerable with people about what I'm experiencing and what I've been diagnosed with, because I feel it helps them advocate for themselves with their own doctors and maybe compare symptoms, and they can say, I'm seeing this in other long haulers. I would like you to look into this, especially because physicians right now are just like us trying to piece together the puzzle. So the more people who speak out about experiencing certain issues, the more attention hopefully it will get. In terms of being a first responder, being a patient myself and wanting to desperately have answers for what's wrong with me and how to cure this has fueled my fire as a first responder, because now I'm unable to work. I feel like I'm sidelined during a pandemic. I'm not able to do my job. And a lot of my advocacy work, I guess in my own sense, is a way for me to be able to help during this time, since I can't physically be out in the field as well. So I have a health science background on top of my firefighter paramedic training. And on top of my field experience and my hospital experience, I think that puts me in a really unique situation. And by no means am I a physician, but I'm able to see patterns. I'm able to go through differential diagnoses. I'm able to kind of connect the dots that the layperson is not able to pick up on. There have been a couple people in the groups with some serious things that I'm able to message and say, hey, I think you should get this checked out. Ask your physician about X, Y, and Z. There are things that I can put together for myself to say, well, this looks like X, Y, and Z. Let me look into this. It helps me move forward in my research. It helps me put together the pieces of the puzzle, and it helps me be a better advocate for myself with my own physicians. Because a lot of the time, these physicians, utmost respect to all of them, but they are not dealing with what we're dealing with as patients. And there are not as many long haulers out there who are able to speak in medical terms to their doctors to really get the point across to what they want to say or what they're feeling. So I feel like I'm in a unique position, both as a patient and somebody with a little bit of a medical background, to be able to communicate what's really going on and back up with data and education about why certain tests are needed or why it's important to go over these things that I'm experiencing.
Absolutely. Wow, Karyn. And first of all, thank you so much for both your service as a first responder and for just sharing your thoughts just now about why you turned to advocacy. Resonated very strongly with me. That's very similar to my own journey about why I ended up becoming the advocate I did, because I couldn't let these injustices and this pain continue. And it just, I am so touched, and thank you. And thank you for sharing your story. So you sort of talked about this a little already, but could you go through the specifics about what led you to create the COVID long hauler advocacy project?
Yeah, so around June, I had still never heard of long haulers. I went to Google and I typed in COVID issues for months. I found an article written about long haulers that spoke about online groups. I joined 2 of those online groups, and I was blown away by the amount of people who were just like me, experiencing issues for months. I started asking questions like, who's experiencing this? How long have you been experiencing it? How long have you been sick? And that led me to create some of the surveys. I have done 3. Probably many of our listeners have been participants in those surveys. And
Thank you.
and really, the first one, we had 1,700 respondents, and it was really all about COVID symptoms and how long they had been sick. And I thought that that was rather groundbreaking to have a patient-led survey, because that was the first that we all kind of got a look at having over 100 different symptoms between all of us, when we were only looking at fever, cough, and shortness of breath. So
Right.
that was the first that all these things were highlighted. That led me to create the group so that I can further share the links to take these surveys, the results of these surveys, and just kind of follow other long haulers. That has turned into a much bigger movement for patient advocacy, because as these surveys went on and we dug a little deeper, our most recent one asked about the experiences and needs of long haulers. So things about, how is this affecting your finances if you're not able to work? How is this affecting your relationships with your friends and family? And are you able to care for your kids? And how hard is it to just take a shower? Like, we really dug into what we're experiencing and what our needs are moving forward and what our futures look like. And the group is really focused on advocating for patients in multiple ways. We provide resources, we do the webinars. I have a ton of resources that if people are on the page, they can go into files and look at them all. That's post-COVID care centers, websites for information about COVID, the articles that all of our members have done for the media, and so on and so forth, all of our surveys and studies. But we're also fighting for post-COVID care centers in every single state so that everybody can access that. We would love for that to be an international thing, because it's not like we only have this issue here. We're fighting for the recognition in Congress and Senate for funding and research to go into COVID, especially because, as my last recent survey showed, 1 in 3 long haulers are developing dysautonomia. 1 in 5 are developing autoimmune disease, and almost every long hauler will tell you that they suffer from chronic fatigue. So there's 3 aspects that long haulers are being diagnosed with. And unfortunately, when a long hauler goes to a physician and asks, like, they're hopeful, like, I'm finally going to get an answer, I'm finally going to go to a doctor, and then they get these other diagnoses, they're kind of in the same spot that they were, because there's no cure or treatment for these things either. And I think with COVID long haulers being such a large influx of chronic illness patients at once, we have to use this opportunity to not only fight for long haulers, but to also fight for these other communities, because we're now part of these other communities. And and I'm saddened at the fact that our group is growing greatly now, and I'm happy that these people are wanting to be part of this advocacy work, but I'm saddened for the reasons that they're having to join these groups. And it makes me fight a little bit harder, because every day right now we're still seeing over 200,000 infections a day, and even if we're estimating 10 to 35% of those being long haulers, I mean, that's thousands of people every day becoming a long hauler. And you break that down again, 1 in 3 are going to develop dysautonomia. 1 in 5 are going to develop autoimmune. So we have to, 1, find a way for prevention. So we work on education about prevention on the page as well. We offer the support for not only COVID patients, but their friends and their family, their support systems. And as Hunter was saying before, we have people saying, can I bring my physician into this? Can they read some of the research? Can they see the stories that people are going through? So anybody is welcome in the group, even if you are none of the above of what I just talked about, but you're willing to help us advocate. Please join us, because we need all the help that we can get. We need every voice. We need strength. There's power in numbers. But most of all, I mean, I think we all need to come together and fight for the common goal of pushing for research and funding to figure out what we can do for, 1, prevention, and 2, to find a cure. Because if we do nothing for these long haulers, even the communities that I just talked about prior, these are people that are likely going to live the rest of their lives dealing with these issues, which is going to affect their quality of life. It's going to affect their relationships, their financial status and employment, and so on. You can't, and the effects on the economy that has is astronomical. So,
absolutely. And Karyn, I'm so grateful that you pointed out that this has brought everyone together, because again, we are so grateful for the Long Hauler Advocacy Project signing on to our letter to Congress calling for research. And you really hit the nail on the head. And in our experience from the ME CFS community, that, it breaks our collective hearts and breaks my heart that this painful, awful experience that the ME/CFS community has been going through with the medical community for so many years is just being repeated by the long hauler community that is getting the exact same runaround, lack of support that the ME/CFS community has been dealing for years. And we've been actually working very closely with the folks who, the subset of long haulers who are getting ME/CFS diagnoses, along with the folks getting dysautonomia and POTS and mast cell activation and all of these other illnesses. And I will say, while it is heartbreaking and devastating, and I hate that there's so much pain, I am grateful that it has brought us together, that we're having this conversation, that exactly your call for unity, that this is beyond our little specific disease definitions. This is a bigger systemic problem, and I'm so grateful that your work and our work have aligned and brought us all together. So we just have time for one last quick question before we go to the Q&A with the community. So this is a question that I really was very excited to ask you. If the congressional leaders and staff were listening to this webinar right now, what is the most important thing you'd want them to take away from our conversation today?
Really, the impacts that this is going to have, not only acutely, but in the long term. We're talking about, if I use the numbers now, let's say we're at 15 million cases in the US alone, with the estimate of 10 to 35% becoming long haulers. We're already at 1.5 to 3.5 million long haulers. Add to that what I talked about before. We're talking about this influx of patients into the chronic fatigue community, into the dysautonomia community, into the autoimmune community. And that floods our medical system to a point where they can't operate. That pushes the economic burden, not only on families, but to their local governments, way beyond what they're capable of. I can use an example alone of POTS. They compare the disability of POTS to that of COPD or congestive heart failure. And that costs over, I think it was $860 billion a year. We're looking at long haulers with a number 4 times the amount of that right now. So imagine that cost moving forward as these numbers continue to grow. We could not handle that as it is right now. We need to address this issue now. Massive, massive, massive research and funding needs to happen right now. There's no waiting. There's no let's wait and see. The longer we let these people go on, and I say this all the time, is while we are developing some of these things, there are people who have not been diagnosed yet. What is the time frame, if this is reversible, that we can intervene and prevent these people from becoming long haulers? And we need to figure that out, because look where we are now. We're not even a year into this pandemic, and we're looking at at minimum another 6 months to 2 years of this before vaccinations take place and we really figure out what's going on with that. We can't handle these numbers, and these people deserve to maintain or regain quality of life. And financially, we can't continue on like this. There's even Social Security disability. How many people can apply for that and live off of that? So this is detrimental to people's quality of life, their livelihoods, their families' well-being. So we need to act.
Hear, hear. Thank you, Karyn. And so glad that we can continue. And I look forward to continuing our advocacy work together. So now we'll turn to questions from the audience, and there's quite a few. So I'm going to try to smush them together to get through as many as we can. Several folks have asked varying questions around the theme of vaccines. Specifically, are they safe for people with ME/CFS? Are they safe for people who have long COVID, since some new studies suggest that the immunity provided by getting the disease only lasts a certain amount of time? So vaccination would be a long-term solution. Is it safe for long haulers? And obviously, again, reiterating that we cannot provide medical or legal advice, so folks should definitely consult with their specific physician about your health needs. But overall, what is your sense about the question of looming in a lot of people's minds about vaccine safety, especially with other complications in your immune system?
Maybe I'll take the first stab, and I'll say that, first of all, We still don't know. There are many, many unknowns. The vaccines that are now up for approval have been tested on healthy volunteers. So our data at this point, at least the data that's available at this point, doesn't really go beyond what are known as healthy volunteers. So I think it's very difficult to answer this question with specific data because the data are just are not there. I would also say that some of the vaccines, particularly the one that is now up for approval actually today by Pfizer, is using new technology, which is fantastic because that really led to how quickly it could be developed. But this is a method that hasn't really been used before. So our experience with this specific technology is very limited again. So I think it's really hard to make any specific comments right now based on the data. What I would say is that clearly, when we were asked to provide comments on behalf of the CFS community with regards to prioritization of vaccines, so I think that what we've been asked when we were asked to provide comments, our comments were that certainly the immune system of people with ME/CFS may be altered. We were very well aware of either comorbidities or symptoms of sensitivity to other chemicals. So in some cases, that puts people in a more sensitive position that they would definitely need to talk to with their healthcare providers. But also to recognize that in some cases, people may be more prone to a more severe outcome, which would be the reason to actually get vaccinated as early as possible. So all those things are playing out in at an individual level. This is not something that could be made as a recommendation for the public. And I think it does require very specific conversations by individuals with their healthcare providers.
So this one comes from Sally. And so this might be some early preliminary research from both your surveys, Karyn, but she asks, what is the percentage of long COVID patients who are recovered by the 3 or 6 month point?
I can speak to our last survey. So, this might not go over too well. We had 1,196 respondents, and only 34 of them reported complete recovery. So many long haulers, and it was specific to long haulers, so those numbers could be skewed a little bit because we're only looking at long haulers in these studies. But we have so many people. I can share it with you guys. I'll share it on our Twitter. I'll share it on our page again, the results, if you want to read through them. I did monitor who recovered after 3 months, who recovered after 6 months, who recovered after 9 months. And again, only 34 out of almost 1,200 said that they had complete recovery. There was no consistency in the weeks or time frame that those who recovered did recover. So it's a very personalized basis. Again, we have no idea why we become long haulers, why maybe somebody's a long hauler for 6 months and then they recover. We don't know what's helping them recover either. So a lot of these results to look over are really eye-opening. They should really be shared with more people in the research community because I think they prompt some excellent questions and some excellent things that we really need to look at. So I'm hopeful that these surveys start to fall into the hands of others who have more expertise. As I'm a patient, this is a patient-led survey, but I would really like some more people to dig in deeper and really explore these things at a much larger scale because it's important data, and realizing who improves after a certain amount of time may also give us some insights on how efficient a vaccine could be for us as well.
Oved or Hunter, would you want to weigh in, or should I go on to the next question?
I just wanted to add one more data point, which is really to say that our experience from the ME/CFS community is again very limited. But I'll mention one study that was done following people who had mono. so the Epstein-Barr virus, and that was a study that looked at people from the very beginning of their infection, and about a year after, there were about 11% of people who continued to have symptoms that would be considered to be, ME/CFS-like, and after 2 years, that went down to about 4%. So these were, of course, this is looking at the entire group of people who got infected, maybe different from what we're Karyn from your specific survey, but that does give us a sense that people over time, some people do recover, and some people continue to have symptoms even beyond 2 years from those specific infections.
Wonderful. So the next question comes from Ariel. Ariel, so apologies if I'm mispronouncing your name. And she asks, specifically for Karyn, with your knowledge and familiarity in the first responder and medical world, have you seen stigma related to long COVID, ME/CFS, the syndrome soup, if you will, that seems to follow? And if so, do you have any thoughts or suggestions on how to circumvent that stigma or communicate with doctors around these complex symptoms?
I'm not sure if she's referring to as a firefighter paramedic and within the medical community, like if you're a nurse or a doctor or a firefighter being a long hauler and still dealing with these issues. I would say that yes, there is a stigma because we are people who are expected to be at the top of our game 100% of the time. Some of our jobs as firefighters and paramedics depend on our ability to 100% physically perform a job, be 100% mentally present. And in a condition of our employment is the ability to be in complete health. So a lot of people who are suffering, and I do know of some other firefighters from other departments that are still dealing with long-term issues from COVID as well. And they're trying to truck through this extreme fatigue and all of these symptoms while still trying to work because they don't want to lose their jobs. They don't want to talk about it. And in general, I think there's still a huge taboo around chronic illness across the board. And I think one of the things that we're doing right now and having so many people speak out and tell their stories is taking that taboo away. We're normalizing chronic illness because it's not the plague, this is something that real people experience on an everyday basis. And to not talk about it is a disservice, not only to ourselves, but to others. So I think that having this taboo, whether you're in the medical field or not, I think that the healthy thing to do is to talk about it, to explore it, one, to accept it. If you continue to fight the reality, it stresses you out and it doesn't allow you to open your mind to other resources. It sometimes prevents you from wanting to speak about it to others. I know people, even myself, I have some family members who tell me, shake it off, you're fine. And there's people who are going through separations and divorces right now because they don't have the support system. So I don't think you should be holding anything back. I think that you need to be honest with yourself and be honest with others about what you're experiencing, because you never know who can step in and actually provide you that support or help you.
Absolutely. Thank you for that comment. And so unfortunately, we're running a little past time. So this is going to have to be our last comment. And it comes from Diane, which I find really fascinating because I've heard a lot of interesting comments on this. So Diane asks if you have any idea from the early data that either Karyn or Hunter you have looked at regarding the sex differential, male versus female, with the long hauler population. And I add this because I've also seen studies that show that women in particular are more resilient in terms of the initial COVID onset, have a lower death rate, have a lower infection severity rate, yet seem to be more common in the long haul community. Could you speak to what you've seen in your data regarding sex differences in both acute and long COVID?
Let me hit this quickly and now let you finish up with this. This data is an absolutely fascinating rate. So what we're seeing is the percentage of women that are dealing with the COVID long haul is in the 70% range, is from what I'm seeing. And so it's absolutely fascinating that a lot of people who did not have the serious effects, they're getting So there's a high prevalence of women, a high prevalence of middle-aged women that are dealing with this. And so this is why it's so important to get federal funding for a research project, because this is, if our mothers for the next 20 to 30 years are going to have to be dealing with this in a way that's very different from the men, we need a really serious federally funded research project that can help us understand that, because that number that I've recently seen, that's the data that I'm seeing also, and I do not understand why. Karyn, do you have a perspective?
I'm not really sure why. I mean, obviously our hunch would be something related to hormones with the gender difference, but we don't know for sure. I can speak to the last survey that we did, and we found that 89% of the respondents were female. And I had made a post a couple days ago comparing this to the other chronic illness communities, because with 89% of long haulers being female, it's estimated that 85% of POTS patients are female, 75 to 85% of ME/CFS patients are female, and 78% of autoimmune patients are female. So there's absolutely a trend here. What connects these all is something that we need to figure out. So definitely more women, and it's a sad thing. And as Hunter was saying, I mean, this not only affects the economy, but it affects the family dynamics too going forward. So we need to look into this.
Absolutely. Well, thank you all. That brings us to time today. So I just wanted to thank again Karyn and Hunter. Thank you so much for joining us. For those of you who are on the call who are fighting long COVID or current COVID infection, please go to both Karyn and Hunter's websites. They were on the screen earlier as a resource. And also, if you're willing to contribute your data, please, we just launched the long COVID study with the UME registry. So please contribute your data. Takes about 20 minutes or so to sign up, to fill out the surveys, to get you into the system. And we're so excited to be able to provide these partnerships and hopefully solutions and answers to these really confounding questions. So last but not least, this has been a presentation of the Solve ME/CFS initiative. We are a nonprofit organization. These are provided free of charge. Our next webinar coming up on December 16th is the UME registry for the whole ME/CFS community. So we really hope that you'll come back and learn a bit more about our registry and our projects of studying long COVID. And last but not least, again, we are a nonprofit and we are able to provide these services for free thanks to donors like you. If you're interested and available to support with either your data, your dollars, or your time, we have lots of advocacy opportunities. We're going to be working with Karyn in the future, I'm sure, on many more to come. Hunter, again, with some expert data and all of your work, and Oved, as always, for your extended leadership. So thank you all so much for joining us this morning or afternoon. May you be safe. May you be sane, may you be well, wherever the rest of the week takes you. And we look forward to seeing you at our next webinar on December 16th. Thank you all so much.